Now for our special campaign, Vaccinate India, in partnership with Google, where we discuss questions that many of you have about vaccines, about coronavirus. And these are questions that you often look up online and Google. And to answer those questions for you, we're joined by Dr. Neha Gupta, Consultant Infectious Disease Specialist, Fortis Memorial Research Institute. Thank you so much, Doctor, for joining us. And, you know, one of the questions that even so many months after the vaccination drive has started in India in January, even so, people still look up whether COVID vaccines are safe. They often ask online, are COVID vaccines safe? So what would your answer be to that?
Absolutely. I think one must vaccinate. They are very safe. And even now, there are a lot of patients who say that, can I take the vaccine? Young individuals ask for it. But they are absolutely safe. There may be some mild side effects, like there may be some fever, but that can be taken care of with simple Dolo, Yafetrosin, all these, you know, just simple side effects are there. And there may be some soreness on the hand. That's about it. Otherwise, they are most of the time they are safe.
Right, Doctor. Unfortunately, people, you know, they look up a lot online. They follow podcasts or YouTube videos, and unfortunately, there are a lot of anti-vaxxers online. And that's as far as, you know, if we talk about populations in the urban populations go. And then, of course, you have rural India, where there are all sorts of other concerns and all sorts of other misconceptions when it comes to vaccines.
Absolutely. I think in the rural area, what you said is absolutely right. There is a hesitancy for the vaccination. And that is why it's really important for us to create awareness regarding the same. And more camps are being done. A lot of NGOs are coming up and vaccinating the rural areas as well. So I think this should be this should take care in the coming future.
So there's a need to create a lot more awareness around the vaccine drive, especially now that we're going big with the vaccine drive. Yesterday, we managed to vaccinate 86 lakh people across the country, which is absolutely amazing. But we have to vaccinate more and more people, and that's only going to happen if we manage to penetrate the rural parts of the country, and if we have enough awareness, enough counseling around the vaccinations, isn't it?
Absolutely. It's awareness which is very much needed. And even among the urban area, the population, for example, the low socioeconomic status, they also need to be made aware regarding the efficacy and the need for vaccination.
Right. Another question, and I know you've answered a bit of this already, but are there any side effects to the vaccines? That's another question that people often look up.
So, most common side effect is mild fever, and some people may get high fever for a day or two, but it's usually subsides back. And otherwise, there may be soreness at the site of vaccination, and all this can be taken care of. It may be just for a day or two, and can actually be easily handled with just a paracetamol.
All right. Well, Dr. Neha, they're answering the questions that people often have and ask online, and some of the questions that they continue to ask even months later is about the safety and side effects. Dr. Neha, back with us. Is there any special sort of care people with, you know, certain conditions need to take when they go for their vaccines? If they're, I don't know, diabetic, have some cardiac issues, also if they have allergies, do they have to? If you could tell us, you know, what care needs to be taken.
Absolutely. So the only contraindication is if there is anaphylaxis to any kind of drug. It's not just allergy. Allergy can be different type of allergies. It can be simple mild allergy, like maybe some rashes, but that's not a contraindication. If there is a severe allergy, anaphylactic reaction, which is requiring to any drug, which is making where there is a need for oxygen requirement, difficulty in breathing, only this is a contraindication for the vaccination. Otherwise, even patients with diabetes, hypertension, patients who are on blood thinners, patients with HIV, immunocompromised patients, transplant recipients, all these patients can go ahead with the vaccination.
All right. In fact, they are the ones who are most vulnerable and should go ahead. Well, thank you so much, Dr. Neha Gupta, for joining us on the program.
Thank you, Gargi. Thank you so much.
Thank you.